In the days up to the 9th of May, you'll see Russians wearing these rather smart orange and bronze ribbons. They commemorate victory in World War II. It is amazing to think that the Russian government's own Committee for Statistical Research says that the Russian population will go down around 11 million people between now and approximately 2025. That's as many men as the Soviet Union lost in its armed forces in World War II. Indeed, the United Nations believes that by 2040, population decline may be as bad as 20 million people. And that's almost as many as the whole loss of population in the Soviet Union in World War II. It's against this rather gloomy background that MMD today publishes our latest think piece, What's Killing Russians and Who Cares? Our think piece looks at a number of areas. It tries to tally together latest outlook and thinking on Russian population forecasts. It also looks at morbidity and mortality. What are the biggest killers of Russians, including cancers and other lifestyle factors such as alcohol and tobacco? Finally, given the new spotlight on Russia First and the importance of channeling healthcare spending to Russian pharmaceutical companies over Western companies, we also look at the sort of things that Western pharmaceutical companies should be saying to Russian stakeholders, including government, NGOs, and the medical community themselves. This think piece has been produced by MMD's healthcare PR team and our regulated industries government relations team. These teams work a lot with pharmaceutical companies operating in Russia, but the think piece has not been in any way shaped by those pharmaceutical companies. Equally, it's another MMD client, Credit Suisse, which recently said that healthcare was part of a nation's intangible infrastructure. If you look at all the other achievements of Vladimir Putin's presidencies and then his premiership, healthcare is an area that stands out as where there has been too little progress made by modern Russia. In our think piece, we try to look at the reasons for that and also suggest ways in which this reform may be carried forward in the next 2 to 5 years. In charge of this reform of the Russian healthcare system is Tatiana Golikova, the Minister of Health. The World Bank has said the problem in Russia is not that there's not enough money spent on healthcare, but there's too little return. We've seen big reforms in the last few years as the government has broken up the big central purchasing of pharmaceuticals, in part so as to remove the possibility of massive scale looting of the state budget in corruption. Now, more and more pharmaceutical purchasing has been delegated down to the Russian regions. The question, however, is how does the state direct overall healthcare reform so as to ensure a greater efficacy of the money that's spent and to ensure that more money that is allocated to healthcare actually gets to primary care and directly to the Russian 9th of May.